Lynch from the Gazette.
Can you say your first name one more time, sir?
James, James.
Thanks. Gotcha.
Later.
4 minutes. Yeah. Okay, I'll try to go with 11. It might be 11:02, 11.
That won't happen.
So 5 minutes late. Yeah.
We can just move.
Yeah, Andrew says we're trying to do these 2 minutes. Yeah. Minute. Chad. Andrew says we'll start at 11:05. Cameras live.
time's 11:30.
Everything all right?
Everyone for your patience.
We're gonna start the press conference at 11:30.
Okay, that's fine.
Are you having technical difficulties?
So there's a there's
New changes to the website?
changes being made to the
And
website.
it's being glitchy, I've seen that, so is
Yeah,
that?
and so what we're just doing is we want to just make sure we have all the visual aids
Yeah,
ready to go
yeah.
before we start the press conference. Okay, thanks.
to always stand away from Aaron Murphy.
Okay. Well, good morning. First of all, I want to apologize for the delay. We have had a large volume of that's been using the new website, and we didn't have the processing power that we needed. So they are working on that, and it should be ready to go later this afternoon. So we'll go ahead and start with an update on the numbers. We had 189 new positive cases today for a total of 1,899 positive cases. We had no new counties, so we stand at 82 total counties in the state. We have 481 negative cases today for a total of 17,467 negative tests. The State Hygienic Lab has 3,415 tests available. We had 163 hospitalized as of last evening. 790 Iowans have recovered for a recovery rate of 42%. And I'm very sorry to report that we have had 6 additional deaths for a total of 49 deaths in the state of Iowa. So today's positive case count is the highest that we've seen, and I want to explain a little bit of why that number is so high. As you're aware of, a Tyson plant in Louisa County has experienced an outbreak of COVID-19 among its employees. And public health has been working closely with management at the plant to test their staff. Yesterday, the State Hygienic Lab confirmed an additional 86 positive cases related to the outbreak at the facility. So of today's total 189 positive cases, 86 of those are related to the Tyson outbreak. The Department of Public Health has also confirmed that we have 3 additional outbreaks in long-term care facilities. Bartels in Lutheran Retirement Home in Bremer County, Trinity Center at Lutheran Park in Polk County, and On With Life, a residential facility located in Polk County. The Department of Public Health and the local public health officials are working with the management and staff at the facilities to ensure that all steps are being taken to make sure that we isolate sick residents, assign dedicated staff members to provide their care, and monitor all other residents. On the day that I announced Iowa's first positive COVID-19 cases, I pledged to keep Iowans informed and to be as transparent as possible. I began providing daily updates of confirmed cases by age group and county, and later provided the same information for deaths. Then, as new information became available over the course of the last several weeks, we have continued to expand the updates to include additional information such as the number of Iowans who are hospitalized, those who have recovered, and our overall recovery rate. Last week, I reported new information from Iowa's 6 RMCC regions about hospitalizations, bed capacity, ICU availability, and vent availability as well. And this was all done to facilitate critical information sharing and coordinating healthcare resources within a region or across the state during this crisis. Our goal from the beginning has been to provide Iowans with the information that they need so that they can understand the current situation and what it means for them. So today I'm pleased to share that we're making more information available and more accessible with the launch of a new dashboard on our website, coronavirus.iowa.gov. The dashboard includes the numbers that I report in my press conference each day and more, such as the total number of people tested and recovered in each county, the total positive cases by county and age group, the COVID-19 assessment levels for each region, and Iowa's epidemiologic curve. Dr. Padati is joining me today to give you an overview of the EPI curve. But first, I want to give you a quick tour of the dashboard and the information that you'll find there. So, and the dashboard will be available later today on the homepage, again, of coronavirus.iowa.gov. Just scroll down until you see it. So the first page of the dashboard shows current status, where you'll see the statewide totals for confirmed cases, deaths, people tested, and cases recovered. You can hover over any county on the map to see the county name, the number of confirmed cases, and the number of deaths. If you click on the county, you'll see even more information, including the number of people tested and recovered in that county. You can also access some of the same information in tables so that you can see more results at once, including cases and deaths by county and cases by county and age. Lab testing provides the number of individuals tested and the test results for each day. So again, if you hover or click on any bar on the graph to see the number of positive test results in red and the negative test results in gray. The Demographics tab provides additional information about the Iowans who have tested positive for COVID-19, including gender, age group, race, and ethnicity. The long-term care dashboard identifies the facilities with confirmed COVID-19 outbreaks and includes the number of positive cases among both residents and staff of those facilities. The RMCC dashboard provides the information about hospitalization and resources that we've been sharing since last week. The information you see at first is a daily roll-up of all regions, but you can click on any region to see its data for the day. And finally, we have also included the regional assessment map showing which level each county currently ranks. And now I'd like Dr. Badati to share the EPI curve and provide an overview of what it tells us about the current status.
Thank you, Governor Reynolds. So when we think again about epidemiology overall, what we're talking about are the trends or patterns in health and disease in a given population. And the way that we orient epidemiologic data is always by person, place, and time. And so you've seen in the information that the governor shared how we describe the people, the cases who are affected by this illness, things like age category, gender, and race. You've also seen how we describe the geographic location or the place of where we're seeing cases, looking at the county levels. So the last element in understanding the patterns of an illness in a population is time. And so often you'll hear us talk about an epidemic or EPI curve. And this is one example of the way that we orient data to understand the progression of an outbreak or illnesses in a population. So what you can see is an example of an EPI curve, and this is using the date of illness onset for individuals who became ill, who then were contacted by public health and provided information about when their symptoms first appeared. Now, using something like an EPI curve is really helpful because it helps orient data over time, so you'll see case counts as well as the date on this curve. And then it also helps us understand things like the magnitude of the number of people affected and the progression of an outbreak. And this gets back to the idea that we've heard about many times related to the desire to flatten a curve. So for example, what we want to avoid is seeing a curve that looks too much like a mountain peak, which would suggest that a lot of people are getting ill at the same time, and that has the potential to overwhelm our healthcare resources. And so that's why all the while we're looking at patterns in time, the number of cases that we see, as well as looking at our resource availability on the RMCC dashboard that you saw to help us understand where the capacity exists to help address needs as they should arise. So again, when we think about wanting to flatten the curve, it has to do with the idea of too many people wanting to get on a train at the same time. If we try and put too many people into the same train car, we overwhelm that system. But if we can stagger the use of that train car and avoid rush hours, then we can manage that in a better way and optimize care for the people who really need it. That's what we're doing by encouraging the use of these public health mitigation and social distancing strategies. That's why we urge everybody to stay home as much as possible, and we follow this information every day in things like the EPI curve.
Thank you, Dr. Badati, and I want to again express my gratitude to you and your team for your leadership and expertise throughout the last several weeks. The effort that you have put forth in your team is remarkable, and I was very fortunate to have the team that we do. I also, again, want to thank our local public health officials in each of our counties. The role is so important, their role to understanding the situation in communities and protecting the health of Iowans. So please know how much you are appreciated as well. And with that, we'll go ahead and open it up for questions.
You mentioned the outbreak of the land in Iowans County. Can you expand on the, you said public health is working with them there. Can you expand are you gonna have to look at more serious recommendations or steps to address outbreaks like that?
Well, they really have been very proactive, and I want to appreciate again the ability to get extra testing capacity down to the location. So we have tested a total of 186 positive at the plant. I said yesterday DPH was able to send 200 swabs down to the plant, working with the facility so that we could start to get the individuals tested, understand who was positive, who was negative, which is part of the scenario in opening the plant back up. The plant is also putting in a lot of measures to protect the employees. They are doing screening, they're providing masks, they're providing face shields, they're being very upfront. If you are sick, stay home. And so they have really been, I think, very proactive in making sure that when they stand the plant back up, they're doing everything that they can to not only protect the employees, but to continue a really critical piece of our food supply chain. So, and then today, they, as I indicated, out of the 189, 86 were positive, but we're going to continue to test at the plant as well. And then we've also reached out to other packing plants and businesses with the guidance that the Department of Public Health provided to businesses to make sure that we can see if they have any spike in the number of illness at the facility so that we can get in front of that and again try to do some testing so that we can figure out if there is, you know, a certain number of positive that we would need to take further actions.
So is that to say that you're kind of boosting or looking at boosting safety regulations of some of these other plants, even if they don't have any known cases? What is kind of the strategy now that you've seen this big spike down in Wise County and, you know, with other plants elsewhere? What's the state doing to try to prevent this?
Well, actually, when I reached out to the CEO of both of the plants, they had indicated they'd already taken the steps. So they are trying to be very proactive to not only protect their workforce, but to make sure that they can, you know, keep the plant up and going. And so they have been, I called to see if there's anything else that we could do, if they're getting what they need, that we could provide the testing, working with their team to start to identify and then do some of the contact tracing so that we would know the exposure so we could start to see you know, what the potential risk for the plant was. And, you know, they have already started putting in doing specific things to protect that. But then in addition to that, the Department of Public Health has been very proactive in providing guidance to businesses. You know, disinfect areas, practice social distancing, wear face masks, face shields, stay home if you're sick. So they have sent out a couple different iterations of guidelines for businesses to practice if they are up and running.
It seems like this, at least the state lab has more tests on hand. I mean, we've seen the past 2 days, you said more than 3,000, but the state's testing criteria hasn't officially changed since March 25th, and there's still some, seems pretty stringent criteria, including if you're hospitalized, if you're an older adult, or you're a healthcare worker. In light of these new cases down in Wise County and these plants, are we expanding where those testing capabilities are allowed?
Yeah, and they are, but I'll let Dr. Padati talk to you about that.
Yeah, thank you for the question. It's a great one. And so all along as we go through, you know, we recognize that there have been challenges around testing. We continue to expand and update those abilities across the state, not just with the State Hygienic Laboratory, with other in-hospital laboratories, and of course with commercial reference laboratories as well, which don't have to use the same criteria as our State Hygienic Laboratory. And so thankfully we're seeing that capacity increase, you know, as we move from day to day. But we have actually made some of those additional expansions, and we're in the process of providing those updates on that webpage as well. But for example, particularly in outbreak settings, we're looking to use testing as a method for control when we find a problem in a long-term care setting or a plant. So we continue to do that, and we'll continue to work on that going forward.
Also with the packing plants, should all packing plants be using face masks and other things now? Are you aware of that, if that's happening at all packing plants across the state? And how serious could these shutdowns be, either for the meat supply at grocery stores, but also for farmers planning to deliver livestock?
Well, it's incredibly important because that is a part of the food supply chain. And so we have to make sure that we're not only protecting employees, but we're doing the recommendations that have been put in place by the Department of Public Health. And believe me, these facilities are doing that. We'll continue to reach out to them to make sure they're getting what they need, to make sure that they are getting their questions answered. Shift changes, understanding who is positive, being proactive and getting in front of that so we can do the contract tracing to see how many have been exposed. Face shields, masks, a lot of them are doing screening when you come in, temperature screens, much like we do here at the CEOC, so that they are doing an assessment on the front end to see if they have any of the symptoms, taking the temperature, and then providing face masks and face shields. In addition to that, several of them are starting to put in kind of plastic separators between the employees. So they're continuing to, I think, really step up and protecting the employees and making sure that they can keep the facilities up and running, because it is critical, and it's critical for the supply chain as well, especially for our producers.
PPE shortage, you guys officially issued an order last week. Obviously, some of these workers at these plants need some of this protective equipment. So how are you balancing, healthcare workers who absolutely need this equipment and these food supply chain workers? Is there rationing of supplies for the, are they handling it themselves? How is that looking?
They're handling it themselves, and then I talked to one of the CEOs. They had just received one shipment. They were expecting another this weekend, so that they thought that they would have enough for their entire system. So they are proactively ordering for their facilities as well. And so we're just making sure that, especially like if there's any additional outbreaks, if they've seen 10% of their workforce not show up, so that we can try to get in front of it and start, thinking about providing additional testing so that we understand the scope of the illness that they may have at the facilities.
James Lynch of the Cedar Rapids Gazette, go ahead.
Thank you, Governor. Appreciate you making yourself available. Yesterday, you indicated that the peak for COVID-19 would come at the end of the month. Do you anticipate extending the closures for at least the first couple of weeks of May to get it safely past that peak? And as you consider reopening Iowa, will you be doing like governors in other parts of the country, or take regional, multi-state coordination as they reopen their economies?
Yeah. So we're looking at all of the above. So while we're looking at metrics and trying to define and put in place the mitigation efforts that we've had to see that the impact that has on flattening the curve and seeing reduced at some point hospitalizations after the peak, we also are trying to put metrics together to talk about how we reopen the state as well. And so, I'm not going to make any projections right now. We're hoping that we can start that process in May, but I'll have to see where we're at the end of the month. But we are working on what that looks like, what metrics we can use to start to dial back up some of the businesses, and we will keep you apprised to that as we move through the next couple of weeks.
Kay Henderson, Radio Iowa.
Following up on James' question, in regards to a regional multi-state coordination, with which states would you plan to coordinate reopening?
Well, I think we'd look at it from the Midwest. So we've had conversations with North Dakota governor, South Dakota governor. We've talked to the Wyoming governor. I've talked to Pete Ricketts, Governor Ricketts. We talk probably at least once a week, if not more. Missouri, I mean, it just makes a lot of sense. Illinois, to just look at it from a regional perspective. But I can tell you, while we'll look at it from a regional perspective and we'll talk about collectively the metrics that we're using, each individual governor is going to look at their own state's metrics. They're going to look at it from a regional perspective, I would guess, and then make those decisions moving forward based on what the metrics are in their state. So while we can take a look at maybe finding some some agreement in what those metrics may look like. Every governor is going to have to take a look at what's happening in their state and make those decisions based on what they're seeing in their reflective states.
Dave Price, Channel 13.
Good afternoon, Governor. With this new outbreak at the Columbus Junction meat facility, and then looking what's happening at a few of these long-term care centers, the long-term care centers in particular, where they don't allow visitors that haven't 4 weeks.
Yeah.
based on what you're seeing in each of these areas, is this an indication that the spread can be traced to workers? And then in your mind, is it because they do not, or did not at least, have the proper PPEs for their protection and ultimately then protection of others?
You want to take that?
Thank you for the question. You know, I think that as we detect clusters or outbreaks of illness, we're seeing things that are in line with our early understanding of this virus. And as it compares to other coronaviruses in the entire family that we know about, it does seem to move efficiently among people who are in close contact and who live together. So again, I think we're seeing a reflection of household contacts, and then we're seeing a reflection of people who live in congregate settings like long-term carers, particularly when health care is associated, because these are individuals who may have other underlying conditions. And so I think, unfortunately, what we're seeing is a reflection of the spread of the illness that we knew about sort of moving in the community, and it may not necessarily be tied to individual staff. For example, even in a long-term care setting, there's movement of patients for appointments like dialysis or other things. And I think all along what we're trying to do as we learn more about this virus and learn more about ways to implement control measures while at the same time gathering more information, we're trying to encourage everybody to, again, stay informed, stay up to date, visit our webpage and see the guidance that we're sharing there. And we are, continuing to reach out both preventively, with long-term care facilities and with businesses, as well as in response to when individuals find people who are sick. But again, I think it's important to keep in mind what we do know and, the recommendations that we are making, which include things like, really staying home as much as possible, and making sure that people are staying informed.
Rachel, Channel 5.
Hi, Governor. Washington County obviously doesn't have as many resources as we have here in Polk County or other places like that. So will they be getting more resources since they don't have a hospital directly in that area? And then also relating to the number of tests conducted, today's numbers show only 670 tests were conducted, and that seems low from what we've been seeing in recent days. For example, more than 1,000 tests were conducted the day before. So why is that number down?
Yeah. I'll talk about Louisa County first, and that's the whole purpose of the RMCC, so that we can look at this from a regional perspective and a state perspective to make sure that we're coordinating, to make sure that we have the infrastructure in place to help meet the needs of Iowans as we see some of these hot spots occur throughout the state. And so that's the whole purpose of the RMCCs, to understand how we can coordinate, facilitate, take care of Iowans, make sure that we have the proper equipment and that we're not overwhelming one particular hospital, so that they know what the partners are within the region and across the state, and that's working very well. I'm not sure if I know on the test.
Yeah, so related to the lower number of tests that are being reported today, the data that's being updated today reflects testing data that occurred from 10 a.m. on Sunday until 10 a.m. on Monday. And so this pattern of seeing fewer test samples collected on Sunday is something that we've seen for several weeks. So the lower number of tests today is consistent with the pattern that we've seen, and I think it's related to just the fact that there are fewer samples that are taken on Sunday, and particularly this last weekend being Easter Sunday. I think that explains the reason why we have fewer tests today.
Sarah, just to tag on to that, just to be clear, because a lot of people have been asking, is this what it's going to look like going forward, that we're about 24 hours of a lag time, because obviously we're testing on Tuesday now.
Yeah, that's correct. So the RMCC data that's collected, it's collected in the morning, and what we're asking for is for people to report. So, for example, RMCCs today have been asked to report information by 10 o'clock this morning that reflects what happened yesterday. And so the reporting cycles are set up so that they will be the same 24-hour reporting cycle. So it'll be test results that will be consistent with the data that's being reported through the RMCC data collection effort.
Nick, the Des Moines Register, go ahead.
Yeah, thanks, Governor. Along the lines of the food processing plants being kind of outbreak centers, the one across the border in Sioux
they're protecting the employees and slowing the spread and allowing the facility either to stand back up or to stay up and running. And so we're going to, no, they're making those decisions. So they, for instance, they thought, I think the Tyson plant thought they would be able to stand back up this week. And I think as they've seen more positive tests come in, just to err on the safe side, they decided to push it back, and they're anticipating standing it back up next Monday. And in the meantime, we're going to continue to work with them, continue to test, continue to understand what the scope of that looks like, and how we can, do everything we can to do that in a safe and responsible manner. And so they are making those decisions. And same thing with some of the other ones I talked to. They decided to shut down for 2 weeks to get through one incubation period, to continue to assess the employees and understand the scope of what they were dealing with and how they can responsibly bring the employees back on and stand the plant back up, but do it in a responsible manner.
We got time for 2 more questions. Clark Kaufman, go ahead.
Thank you, Governor. On March 30th, you indicated the state's health facility inspectors at DIA were properly equipped to go into nursing homes. That same day, DIA said its inspectors were using PPE from the facilities themselves, and that in some cases PPE was deemed to be not even necessary. Are you concerned about that, and have any DIA inspectors tested positive?
I don't believe they have, to my knowledge. They have not. And PPE has been a concern from the very beginning, and we continue to do everything we can to make sure that we're ordering it from every possible opportunity that we have to bring resources into the state, in addition to standing up businesses and the Department of Corrections and families that are working to provide the additional PPE that we need until we can get our stockpile replenished. So we continue to monitor, manage, to let facilities know how they can utilize the PPE that they have, to make sure they understand where they need to go through to order it if they're not ordering it on their own. And so we're just, it's all hands on deck, and everybody's working to make sure that we're protecting those individuals that are on the front line, doing the heroes that are out there taking care of Iowans all across this state.
Last question, Todd at KCCI.
Governor, we talked to the mayor of Columbus Junction yesterday, and he mentioned that there's only 2,000 people in the town and 1,400 people work at the plant. So he's worried that people are coming, obviously, from counties all around.
Yep.
Is there a concern that this could be wider spread outside the plant, and all these people are coming in and out of the plant from, farther away in Iowa?
Yep. And so, Todd, we're collecting that information, and I think that was reflected in some of our positive numbers last week when you look at the surrounding counties and the increases that we saw there. But we'll be able to have some, we'll be able to tell the numbers that tested positive that's tied to the plan, and they're working on doing that through the contact tracing. So we'll have those numbers going forward.
Thank you.
Thank you. Thanks again for your patience today. I appreciate it.